Hi everyone and welcome. Welcome to another in our continuing series of videos. I will be answering frequently asked questions, and also I'll get to talk with some interesting people that may have different perspectives and means by which we can help our infertility patients. Today I'd like to introduce Dr. Amy Vigliotti and Dr. Mary Sabo, who are going to discuss their areas of expertise, which are respectively clinical psychology and acupuncture, and specifically how they tailor their expertise to our infertility patients. I work with both of these doctors together, and we often synergize in our abilities to help patients. So I hope you enjoy the conversation that we shared. So, ladies, it's wonderful to have you here with me today.
Thank you.
I'm Dr. Drew Tortoriello, as you already know. I'm the medical director here at Share Fertility. And I have the pleasure today of speaking with Amy Vigliotti, who is a noted psychologist here in the city, and Dr. Mary Sabo, who is a doctor of acupuncture. Why don't you tell me a little bit about yourselves and about your practice so we can become familiar with what you can offer?
Great. So I have a group practice called SelfWorks. We have 2 offices in the city. There's about 20 of us in totality, and several of us specialize in women's health and reproductive health. So we can do a blend of CBT, mindfulness, relational psychotherapy, and really support women and their families on this journey to building their family.
That's wonderful. And Mary, tell me a little bit about your practice and what your specialty is.
Sure. I founded Lily and Horn Acupuncture. We have locations in Chelsea and Southampton. And we specialize in reproductive health and fertility. And we really specialize in integrative reproductive health. So we love working alongside physicians and women going through IVF and men, IUI and conceiving naturally. But we really specialize in knowing when to use things like supplements and herbs throughout a person's journey when they're on the track with Western medicine as well.
That's wonderful. You know, I find that probably most of the people that come through here are already doing acupuncture. What would you say to the person who is experiencing infertility, who just made her way to a doctor like me? When should she begin acupuncture? Should she begin doing it immediately? Should she do it only when she's in the middle of a particular treatment? What's your thoughts on that?
That's a great question. The answer is anytime. We usually recommend if someone's going to do an IVF cycle to try to start working with an acupuncturist in the months leading up to, maybe 2 months before the IVF cycle, just to optimize body chemistry, regulate the cycle, bring more blood flow to the uterus and ovaries, and correct any hormonal imbalances. We also, anytime we work with a patient, whether we're working on fertility or anything else, we look at the person's diet and whether or not it's working for their particular body. So there's a lot of customization that happens in Chinese medicine. So all the acupuncture sessions are customized. We prescribe targeted supplements and herbs, and also diet changes to try to help that person reach their goals. So working on those changes in the months leading up to a cycle, whether it's IUI or IVF, is really optimal. However, if you're in the middle of an IVF, there's no time like the present. Typically during an ovarian stimulation retrieval cycle, we like to see patients twice a week, but the typical cadence is once a week for acupuncture.
Amy, would you tell me a little bit about the kind of patient that comes to see you? Is it somebody who has been struggling for a long time and then finally comes to the realization they need a little bit of psychological help? Or is it potentially somebody new just experiencing a little bit of depression because they're not getting as pregnant as quickly as they'd like to be?
I guess the short answer is both. I think sometimes people may anticipate that this is a course of treatment they'll need to build their family. Maybe they're part of the LGBTQ community, and so this is something that's been on their mind for a while. Or maybe there's some, loss and grief associated with it, and that's, I think, a great place that therapy can come in both visualizing what's coming, right? And that's such a big part of what you do, and helping to maintain the hopefulness and the optimism of what's around it. And I think we balance that with helping them sort through if there's depression, anxiety, of course, right? Because there's so much at stake. And similarly to what Mary was saying, we generally work in a once a week format, but sometimes twice a week can be really effective too, especially around sensitive times in the cycle.
Sure.
And and giving them tools to go into your office, visualization tools for when they're on the table and things like that.
Do you deal with patients primarily one-on-one, or is it more of a group setting, or is it a little bit of both?
It's a little bit of both. I love to work one-on-one. And I also love to work in the group setting because I think a lot of the tools that we use for mindfulness-based stress reduction, CBT, can be taught in group format. And then if people get snagged or they want additional support, they can work one-on-one. But SelfWorks offers about 4 to 6 free seminars a year on anxiety management that could be used for anybody suffering from anxiety, but certainly, people who are anxious about forming their family.
Now, I like to flatter myself by thinking that I'm the patient's primary therapist because I deal with them,
You are.
so frequently. But it becomes obvious quite early on that very often people need more. The people that I think tend, from my experience, that need more help along the lines of what you're offering are people with recurrent miscarriages and people who are on the fence trying to decide about whether or not egg donation is the right thing for them or not, because they're having tremendous difficulty with their own eggs and they're trying to figure out if this is something that they can actually feel comfortable with and work their way towards. Do you get a lot of patients along those lines?
Yeah, I think one of the things you're bringing up is that people have a certain vision, maybe even from very young, as to how they saw this going.
Right.
And then it changes,
Right.
either because something's not working in the treatment or a number of reasons it changes, right? So I think therapy can be tremendously useful for helping people bridge what they thought was going to be to where the next step is, and making sure it is the right choice for them and giving them the space to do that. I also think it's such a private matter that families don't get the same support they have with other big decisions. Let's say you're moving. You could talk to 50 of your friends about moving, right? Or you're choosing a school or whatnot. But these decisions tend to be so isolating for couples or for families. So sometimes having you or their therapist or even their acupuncturist that is in on the to talk through it, it's really helpful.
Can you talk a little bit about CBT, what exactly CBT is, so people will understand a little bit more what they can expect if they make their way towards that therapy?
Sure, it's a great question. CBT is one of the most widely studied therapies, and it's been shown to be useful in a lot of different chronic conditions, but certainly with IVF. They did a meta-analysis recently showing its effectiveness and outcomes, which is so exciting, right? Anything we could do to better our chances, right? So what someone can expect is that CBT looks at really the mind, body, spirit connection, but it's got an active focus on the thoughts, right? So it's very natural to go into a cycle if you've had a miscarriage and think it's not going to work, right? You have evidence from your last cycle that it didn't work. And so we help people to separate out their thoughts from facts and also help them to tolerate some of the terrible thoughts that they have along the way. So we can take a very stressful situation like fertility planning and lighten a little bit of it because we're removing some of the predictions and thoughts and maybe even some self-attacking thoughts that women have throughout the process.
That's great. Yeah, I've read so much about CBT, and on so many different levels it helps people. Obviously fertility, but for so many different psychological issues.
Yeah. I think we forget sometimes with our patients, like we see patients going through this every day, all day. And it's like, the level of stress that a lot of women are experiencing. I think the nervous system can't tell whether you're being chased by a bear or whether you're afraid your transfer cycle is not going to work. Like it literally registers as life or death. And I don't know that we always have the language to explain that. And so finding ways like the study with CBT, I think there's also studies with acupuncture and with mindfulness meditation. Anything you can do to balance the nervous system, it improves outcomes, which makes sense. The body, maybe has more reserves to conceive when it doesn't feel like it's being chased by a bear every day,
I'd love to piggyback on that because the same way that the mind can play tricks on us, like thinking that we're chased by a bear, but it's a transfer cycle, or the transfer part of the cycle. We can use that in our favor. So one of the mindfulness strategies, I think you know this very well, you probably also know this from so many patients in your office, is closing your eyes and visualizing somewhere you feel completely at ease. And we practice that in the therapy room, doing it when there's no stakes, right? You're just hanging out, having a conversation. So when you are back here at chair and you really want to feel calm and relaxed, like you're like, oh yeah, I'm right back on the beach, right? And your body really gets tricked. You know, you can feel the ocean breeze, you can taste, you know, your mocktail, and so we do a lot of those mindfulness based strategies to help quiet the nervous system.
They're so powerful. Another trick I'm going to offer, so this can be helpful to people watching, is regulated breathing. So breathing your inhales and then your exhales 1 count longer. So like inhale for 3, exhale for 4 for a couple times, then inhale for 4, exhale for 5. And it tricks the nervous system. It helps switch the nervous system over from sympathetic to parasympathetic. And there are studies on this. So if you can do like 7 to 10 breaths like this, in the waiting room, while you're waiting for your transfer, in the taxi, like wherever you are, you can do eyes open, eyes closed. It helps switch your nervous system over. So one of the things I talk about with my patients is we can't always control the stressor coming in, right? You're going to react how you're going to react to your thoughts, to your, you know, your whatever news you get, to work stress, you know, partner stress, whatever. But if you can work on ways to balance your nervous system throughout the day, then you register less stress overall. So keeping it, you know, making sure you're taking breaks from being in that fight or flight can be really beneficial. Acupuncture is also one of the ways to get your body into that parasympathetic state. That's part of how it works, which in that state, we prioritize blood flow to the uterus and ovaries rather than in fight or flight.
Very, very fascinating. What is it about the acupuncturist who specializes in infertility and reproductive medicine? What does he or she do somewhat differently from the general acupuncturist that you might go to see that doesn't have the focus?
Sure, that's a great question. The answer is any acupuncturist can help someone with fertility. We learn in school how to balance a cycle, how to balance hormones. If you have really long cycles, if you have really short cycles or painful cycles, like the way that your periods and cycles present gives us a ton of information about a woman's overall health. And then we also go over like digestion, diet, sleep habits, energy levels, all other organ systems. And it gives us clues as to where the weaknesses are in the body. And we have the tools to help the body self-correct. It's more like a self-correcting mechanism than it is like, take this thyroid medicine your body's not making, right? It's like sending signals to your body to self-correct and then giving the tools to try to help the body do so. That's kind of how I think of it. So any acupuncturist will know that, and that alone increases fertility. But when it comes to adding medications like Lupron, Menopur, you know, all these medications do very specific things. And the point is to throw the body wildly out of balance, right? Like in hyperstimulation in a retrieval cycle, like we are throwing the body wildly out of balance. So, and it presents symptoms that, you know, an acupuncturist who may or may not be familiar with them might say, oh, this patient's yin deficient in the case of like 2 months of Lupron. Say, you know, they present hot flashes, night sweats, insomnia, you know, irritability. That's all. We call it yin deficiency heat. The treatment for that is yin tonics, which in herbal medicine, those tend to be estrogenic. If you're doing 2 months of Lupron, we want low estrogen environment, right? We get rid of estrogen, we let the body clear inflammation and prep for a transfer. So not fighting against that with estrogenic herbs is super important. So understanding what are the goals of each medicine, what are the goals of each step, and then learning to enhance that goal and, you know, enhance the medications instead of maybe fighting against it.
I have a lot of patients who are told by their fertility doctors, whatever supplements you're taking from your acupuncturist, you have to stop because now you're seeing me and now I may want you to take my particular supplements or I don't know what the acupuncturist is giving you. Is there anything that you would recommend in terms of a supplement that people like me should be concerned about or think twice about having them continue?
I don't think any one particular supplement. We tend not to, across the board, say one particular supplement is good or not good. Anything is, you know, medicinal and appropriate when taken the appropriate way, but can be harmful when it's not. This is why I like to establish relationships with physicians, because I notoriously will be like, Dr. T, I'm sending you this patient. Here's what I want to do. These are the supplements. Here are some abstracts showing it could be helpful. Are you okay with this? And then instead of blanket statement, you saying, you know what, I'm uncomfortable because I don't know what it does.
Right.
We can together make an informed choice to say, let's try this. Let's build the uterine lining with L-arginine and vitamin E, because there's a study that shows it helps for women who have a thin lining. And so then we can monitor. We know that it's safe. It's been done. And so I think, if a physician and an acupuncturist can communicate, and especially if there's research, there's a ton of research on supplements and herbs and acupuncture now, then all parties will be more comfortable.
Yeah, I think that's great. I mean, I think more often than not, I don't really get that information from a lot of different people.
Yeah.
So I'm on something, doctor. What are you on? I don't really know what it is.
Yeah. Exactly.
But that's wonderful to be able to understand exactly what you're recommending and why you're recommending it. And we can sort of bounce off one another in that respect.
Some Chinese herbs are estrogenic, and I think reproductive endocrinologists started to see that and understand it and got scared of all Chinese medicine. Also, they can thin the blood. And so if you're, in a retrieval cycle, you don't want anything that can thin the blood. You're about to do a procedure. So things like that. I do take my patients off herbs and supplements during stimulation cycles, unless their physician's okay with doing CoQ10 or something like that. It's simple. But for the most part, I'm conservative because most of my patients are seeing physicians, and I tend to give you the upper hand and do whatever you say. But some physicians are okay with it, some are not, but I tend to let you guys take the lead.
It's so important, just hearing the two of you talk, because when people come to me, I think a lot of what they're feeling, understandably, is how out of control it all feels, and sometimes they're getting competing information. And when this happens, they come, they're like, oh, it feels good, right? Because there's been a conversation. It's been really thoughtfully done. And even if they really didn't have so much to say in the decision, they left it up to you two, they're like, oh, but they're talking about, they're thinking about me, they're caring for me.
Yeah,
and that
we're a team.
That goes so far.
Yeah, I think I may be somewhat unique in the sense that, although I'm not unique in New York City, but the majority of programs in the city are multi-doctor practices, and there tends to be a diffusion of responsibility among this cadre of physicians. Could be phenomenally good physicians, but when you have the diffusion of responsibility among 6 or 7 physicians, it gets to be, I think, a little bit more difficult to be completely on top of your patient's care and exactly where she is and exactly what her history is. It kind of gets sort of spread out over many people. Here it's a one doctor, one patient practice. Right. So I see you when you sit down from the first visit until you leave, when you go for your visit with your OBGYN when you're hopefully pregnant. So I think that affords a lot more of a tight sort of understanding and the communication that they want to have. So I think I would agree with you on that.
I think that does make you unique in New York.
There's not too many sort of tight-knit practices like that left these days. Everything is sort of merging into one giant conglomerate, and there's something to be said for that when you have a cohesive unit of several good physicians. But I think it's hard to do right. It's easy to put together, but it's hard, I think, to do right. Ladies, it's been wonderful chatting with you. I appreciate you so much coming in here and sharing with me your wisdom and your particular services that you offer for patients like mine. Is there anything I can answer for you? Any questions for me?
I don't think so. I've seen a lot of your patients. You're wonderful. I send people to you.
Well, I appreciate it. Thank you. We can put a bookmark in this, and we could read another chapter another day.
That would be great.
Sounds great.
This has been a pleasure. Thank you.
Thanks, you so
Dr.
much
T.
for coming in. Bye, everybody. I'd like to thank Doctors Amy Vigliotti and Dr. Mary Sabo for sitting down and sharing a conversation with me with regard to how they apply their expertise in the care of infertility patients. This is only one in a series of conversations that I'm going to be sharing with you as I sit down with other thought leaders in the field, and we discuss the various techniques and methodologies that are out there for helping patients with infertility overcome their issues.